Well, hi there, and a very good afternoon. Thanks for joining us for today's Daily Update. I'm Dougal Saunders, joined once again today by Scott McLaughlin, who's the Chief Executive of the Western New South Wales Local Health District. Now, starting off with some reasonably positive news today, I know there are plenty of you that have been very keen to have your local government area removed from the stay-at-home orders. Hopefully, most people will be aware by now that as of today, as of midnight last night, Gilgandra Shire and Brewarrina Shire have been released from stay-at-home orders. From midnight tonight, the orange local government area is removed from stay-at-home orders, and from midnight Friday night or 12:01 Saturday morning, Narromine Shire Council also released from stay-at-home orders. I guess with that really positive news, and I know there have been a lot of you that have been really keen for this to happen, there are a few things to think about, and Scott might elaborate a little bit more. If cases do happen, there is a chance that your local government area will go back into stay-at-home orders. We just need everyone to be aware of that. We're trying to do the right thing. If the cases are not of concern, then that won't happen, but there is always a consideration, and as we know, there are cases popping up every couple of days in locations where they're not necessarily expected. So it's with a really positive note that we look at moving forward, and I think cautious optimism around all of us in those local government areas being able to stay out of lockdown, but with the proviso that it's not a guarantee. Once you're out of lockdown, it doesn't mean there isn't a small chance of going back in if something happens. So I just wanted to raise that as one of those things to be aware of. There are also then slightly different rules. For example, if you're in Narromine or Gill and work in Dubbo, you're still going to be following stay-at-home orders because your workplace is in an area that is still under stay-at-home orders. Hopefully most of that is fairly clear, but look, lots of questions that have been coming through, and I think it's slightly different for every different person, but in general, if either of the places you live or work are at stay-at-home, you have to continue to follow stay-at-home orders, and that's pretty much the rule as it stands. Now, I just wanted to let you know that today will be our second last Facebook Live. We're planning on tomorrow being the last one. I think we've now come through what has been the emergency part of the situation. This has now been, I think, a really good way of providing that one single piece of information for people right across the entire Western New South Wales Local Health District. At this point in time, although things will continue to evolve and change every couple of days, we figure that probably actually having to be here every day to see our faces isn't needed. Every day at midday I will continue to provide a daily update. The Health District will continue to provide all of the information that it currently provides. It's just that you won't get to see my mug or Scott's mug every single day. So just wanted to flag that. We think it's been a really good way of making sure you've had one single source of information, and we will continue to do that. It's just that we won't necessarily be here every day. So hopefully you can appreciate that. It's now up to I think it's day 44 today in a row that I've done these, and it's probably time, I think, to move into a different phase. Now, up until 8 o'clock last night, there were 11 new cases in the local health district. For the first time since August 10, Dubbo itself does not have a case. Now, the local government area does. There are 3 at Wellington. There are also 2 cases at Burke, 1 at Bathurst, and the concerning number 5 at Cowra, and Scott will talk a bit more about those cases and what that means. The health district total now, since August 10, at 1,099 cases, the Dubbo local government area at 781. The far west today, Broken Hill, 6 new cases, and Wilcannia, 1 new case. So from the 11 new cases, we have 3 have been infectious in the community. We know that, Wellington, Bathurst and Cowra. 5 have been isolating, 3 are still being investigated. 189 people still in the COVID Care in the Community program. Another 37 have been released overnight. 37's been the magic number for the past 3 or 4 days now. So that's good. Another 37 that are no longer infectious and no longer needing that care. And the total that have been through the program now and discharged is over 850. It's really been a fantastic program. Testing's dropped a bit, unfortunately, despite the fact that surveillance testing is now available across the entire health district. Testing down to just over 2,400 across the district yesterday, 750 of those in Dubbo, so again a few hundred drop in Dubbo yesterday. Just please be aware of that surveillance testing. If you do not have symptoms, if you're not a contact or living with a person with symptoms or a contact, you can get a test and you can keep doing what you're doing. You can literally do it in your lunch hour or your smoko. Go to the nearest testing facility, get your test, go back to work and off you go. If you have symptoms, you do have to isolate. If you don't or you're not a contact, you don't. And that's the importance of surveillance testing, to try and keep us ahead of things if we can. Vaccination, second dose clinics are still happening right across the region. Nyngan having its final day today at the showground. I've heard good things about how that's been going. Lightning Ridge, final day today at the Indoor Sports Centre. Doo is underway today. 3 days happening at Doo, expecting big turnouts for second doses there. And Eugowra having its second dose clinic today as well. And of course, Mudgee's still running through until tomorrow at St Matthew's School. And there are still opportunities, as Scott has mentioned before. The ADF will be hanging around for a little bit of extra time. There will be opportunities for probably some other first dose clinics coming up, which we'll let you know about when they happen. Westhaven Clinic, the final day of that special clinic with Aspen Medical. It's been running at Westhaven since Monday. Walk-in clinic, it's a Pfizer clinic for anyone in the community. Specifically, it's been targeting disability workers and people living with disabilities, but also Indigenous community members, essential workers, but essentially anyone and everyone is welcome. First or second dose, it wraps up today at 4 o'clock. And just a reminder about booking your vaccination, as we have kept on saying, there are so many options. If you haven't been through one of the ADF clinics, that doesn't mean it's all over. There are so many options, like your GP clinic. Whether you're a client or not, check with your local town and make sure you can get an appointment with a GP. Lots of them have books open to people that aren't clients. Pharmacists, as we know, taking more and more bookings right now for not just AstraZeneca, but also for Moderna. So a really big opportunity in the next couple of weeks around that. So really encouraging you to make every possible effort to get, if you haven't had a first dose, we really need you to do that very quickly. And second dose, make sure you're coming back around again and getting that second dose as well. So look, I'll leave it there for the moment. Ask Scott to come forward and happy to take questions at the end.
Thanks, Dougal, and good afternoon, everybody, and thanks for everyone that's joined. As Dougal mentioned, we're going to change a bit of the format of how we provide these daily updates. I'll still continue to do the daily virtual media calls on a daily basis through next week. I really appreciate the intent and interest from everyone around getting regular updates, but also helping to keep our community safe over the last 6 weeks and now 2 months for these virtual media calls. So, as Dougal said, there's some pleasing signs with 0 cases in Dubbo today, the first for quite some time. And I know the community of Dubbo has both been doing it tough, but also feverishly trying to make sure that we do everything we can to stop the outbreak in Dubbo, and that does seem to be easing. But while Dubbo's easing, there's a number of other locations that are a real concern across the whole of Western New South Wales, Cowra being one of those. And I guess of COVID outbreaks and localities that'll be challenged with new cases from time to time, and we'll need to get better at making decisions around the impact that those have. We know that the testing rates are still a little bit low across the region, so I can urge everyone that's the opportunity that we all have to find out where COVID is circulating around our community, to try and get in front of that and help us to make better decisions around the impact of any new cases in communities. So things will continue to change. We know that the vaccination rates across the region are going to be crucial in helping us to get to the point of stay-at-home orders being lifted, but other freedoms and opportunities that will come with that. And so please, can I urge everyone, today's the day, book in for your first dose if you haven't had one. If you have had, please make sure you've got a plan for your second dose vaccination. It's going to be so crucial for us getting out of this current situation and the bouncing around of stay-at-home orders. The reality for communities that have come out of stay-at-home orders is there's still a risk. As we've seen with Cowra in the last week, when the stay-at-home orders were released, people started moving around, and with that movement became spread opportunities for COVID in communities, and we've certainly seen that in the school and young people community in Cowra, and so I'll come back and talk a bit more about that in a second. So with 11 cases across the local health district, 5 in Cowra, one of those has definitely been infectious in the community. The other 4 have been isolated at home. But with the number of kids in the last week that we've seen infected with COVID, there's some real risk around the school in Cowra, school bus and other venues of concern that are being identified. So can I please urge everyone in Cowra, please come and get tested. If you've got any signs and symptoms, however mild, don't leave your house without coming and getting tested. Vaccination opportunities are available in town this week as well, with the ADF, with the fantastic 2 general practices in town, and now the pharmacy coming online very soon. 3 cases in Wellington, 2 in Burke and 1 in Bathurst. The one in Bathurst we know has been infectious in the community in recent days. So out of all of those 11 cases, 7 have definitely got known links, 5 household contacts and 2 links to other clusters. 4 are still under investigation. We've got a growing number of Aboriginal people with COVID in the last 24, 48 hours. And so for Aboriginal community right across the region, please, this is time to maintain all of the things that have helped keep us safe and help slow the outbreak. So please, if everyone can really try and think about how you engage with family, friends, auntie, uncle, and everyone around you in coming days and weeks, it's going to be really crucial. The aged care facilities across the region, there's some more pleasing signs. No further cases have been identified in either St Mary's Villa, Holy Spirit or the April Aged Care Facility in Mudgee. So some pleasing signs, those residents and staff are continuing to be tested on a second daily basis. So across all of our services, we've got 189 people in our Care in the Community program. As Dougal said, that's continued to decrease by around 37 every day, a consistent number, but the first time we've been under 200 for nearly a month in that program, and so more people getting over their COVID illness. 13 patients in hospital, 5 are in intensive care, with 3 of those people really crook and being ventilated in intensive care. So across the 13, 7 in Dubbo, 5 in Bathurst and 1 in Orange. There's been some new venues of concern identified and made available across the public websites on New South Wales Health website in both Cowra and Dubbo. No surprises in those, but a couple that'll be up in the next hour or two. 3 locations in Mudgee and 1 in Orange, where we know someone has been infectious in the community in those locations. So can I please urge everyone, even though Orange is coming out of a stay-at-home order, there's still risk. There's still people that'll be potentially coming through the community infectious with COVID. It's time to maintain all of the things that we need to do, particularly mask wearing anytime outside of the house. QR code check-ins are absolutely crucial for us. Your hand hygiene and keeping a distance, the 1.5 metres distance from everyone. Testing numbers, again, took a bit of a decline yesterday, even with the surveillance testing now widely available across the whole of the local health district. So can I please urge everyone, if you've got symptoms, don't leave your house without coming to get tested. But even if you don't have symptoms, come and get tested, and you don't have to isolate unless you've been in contact with someone in your household with symptoms or you've been identified as a contact in a location. So please, it's a great opportunity for us to find out where COVID might be circulating around the region and help us to stop it. The mobile at-home testing continues to be available in Dubbo, Orange and Bathurst, and now Cowra. So please call ahead to the 1300 066 055 number if you need to be tested in your home. Vaccination, as I said, is readily available across all of our towns now. There's no shortage of vaccines available. Moderna is starting to roll out right across the pharmacies in the region. So if you look at, for information on your local pharmacy, there's over 180 pharmacies in New South Wales have now received Moderna vaccinations. It's a really high quality vaccination and very equivalent to the Pfizer vaccination, particularly for the 12 to 59-year-old age group. So please look out for those opportunities through pharmacies in your local towns. The general practices, Aboriginal medical services and respiratory clinics all have a lot of vaccine available. So there's no shortage there. And likewise, the Australian Defence Force clinics continue right through until the end of October. But what I would say is we know that there's a 2-week period from when you get vaccinated to when the full immunity kicks in. It's like your superpower protection that kicks in, but it takes a 2-week period. So with the restrictions that are going to be eased in a couple of weeks' time, now's the crucial time to get vaccinated. Don't wait for another week to 2 weeks. We know that protection takes a couple of weeks to kick in with all of the vaccinations. So please, there is some real urgency around getting vaccinated. Listen, I'll leave it there and see if there's any questions for Dougal.
Thanks, Scott. If anyone has any questions for Dougal, could you please raise your hands? Riley from the Central Western Daily.
Hey there. I just want to check if there has been any change or any changes in the coming days regarding hairdressers, the square metre rule, and the cap being lifted of the 5 clients, if that's anything that's in discussions.
Yeah, look, it's certainly in discussions, Riley. Thanks for that. At the moment, the way the health order stands is it's the 1 person per 4 square metre rule, or capped at a maximum of 5 people. Now, we know there are a lot of hairdressing facilities that have the capability of doing more than that and having that space without a problem. So there's quite a few of us that have been talking through that with the Health Minister's office, also through the Deputy Premier's office. So look, I'm hopeful, but look, there's no decision made around that as yet, but we're hoping there can be a little bit of flexibility around that fairly shortly.
Okay, that's all from me.
Thanks, Riley. I think that appears to be it for you today, Dougal.
Excellent.
Thank you very much.
Have a good day.
We'll bring Scott forward. And Riley, you may as well kick us off here too.
Cool. So just on that person infectious in the Orange community, obviously, do we know if this was like a traveller through or sort of any details about that? And obviously, I imagine this news was sort of known, prior to Orange coming out of lockdown. So how will that, or if that will affect Orange's lockdown news?
Sure. So we do know that the locations of concern that have been identified in both Mudgee and Orange have been a traveller, particularly through Orange, back on the 15th of the 9th. So it's the Orange Summer Centre, the IGA, between 11:30 and 12 noon on the 15th of the 9th in Orange. It's a casual contact location, so it's not a high risk where people would be identified as a close contact and needing to isolate for the full 14 days and getting tested. So those are the things that are taken into account with the risk assessment of quite a few things now, whether it's serious detections, testing numbers, how infectious a person was when they were in the community, and the type of venues that they visited and the risk to the community. Now, those are the things that we'll continue to refine, but the best public health experts we've got in New South Wales Health are looking at this on a very regular basis, and so I don't see any impact for the COVID, for the stay-at-home orders being removed from Orange for this.
Okay, and just on the back of that, do we know where the traveller was from, or?
Yes, we do. So it was a case that's been identified in Mudgee that travelled through Orange at the time. There's also 3 venues of concern that have been identified in Mudgee with that.
Okay, great. And then just I wanted to chat about the press conferences essentially. I think Dougal mentioned something ending tomorrow, but you then said presses are still going ahead next week. So can we just clarify what the changes are being made tomorrow, and sort of is there a time frame for when the press conferences will end for the public and us?
Yeah, sure. So I think those have been a great solution while we've had the emergency and the high outbreak and need to communicate on a regular basis. I'll still be continuing with the virtual media conference, the Teams conference with all the media outlets on a daily basis throughout the region. I'll be posting information on our website throughout the day to identify updated information. And so those will continue with regular updates from the health perspective, so nothing changes from that.
Okay, cheers for that.
Thanks, Riley. Sam from the Western Advocate.
Hey, Scott. Just obviously read that new Bathurst case that was infectious in the community. Has surveillance testing helped narrow the case's movements down, or is it another case that's baffling contact tracers?
We have done the contact tracing for that case. We know that they're not a resident of Bathurst, but have been in Bathurst for work reasons for quite a few days and infectious in the community for that time. And so for the Bathurst community, please, this is a real risk in the community. Continue to look out for those venues of concern. Our contact tracers will be contacting people that have been in those venues of concern that checked in with their QR codes. Can I urge everyone though in Bathurst, there's still low testing numbers, even with the surveillance testing being opened up. That means you don't have to isolate if you don't have symptoms and if you haven't been in contact with someone with symptoms. So please come forward and get tested. It's one of the most crucial things we can do in coming days. Having a case infectious in the community means there is risk ongoing for the whole of the community.
Thanks for that, Scott. And my second question is, I noticed you were about to release new venues of concern, but you didn't mention Bathurst among them. Does that mean this case has visited places that aren't of wider concern to the health district?
So I think we're still chasing up some of those details from this case, but suffice to say we'll contact everyone that's been in those venues if we've got those details, and we'll load the venues of concern onto the website if we don't have all of those people contacted.
Thanks for that, Scott. That's all from me.
Thanks, Sam. Chris from Prime 7.
Hey, Scott. Just two questions. Just firstly, what's the general concern for the region at the moment? I know obviously it's good news. Dubbo had no new cases, but Cowra had 5. And Lithgow, I think, is well got 3. So what's the concern at the moment?
Sure. So I think what we've seen in Cowra is the movement of community when stay-at-home orders are lifted means there's a real risk that one person in community that is infectious can spread to a lot of people very quickly. And I'd expect we're going to see the case numbers grow in Cowra. We've got continuing outbreaks and locations of concern both in Burke and Walgett at the other end of the region. We know that there's been people infectious in the community in Bathurst, in Mudgee and other locations across the last week and 10 days. So what this means in reality is every community every day of the week has a risk that there's someone in the community with COVID. So whether you're in a stay-at-home order area or not, it shouldn't change your behaviour every day of the week. That the masks are absolutely crucial to helping us slow the spread of COVID. All of the things that we know have kept us safe, whether you've got stay-at-home orders or not, are going to be crucial. So if you're being released from stay-at-home orders, then please don't go out and think that everything's okay. We've still got COVID circulating around our community. The reality that we know is coming at us is in the 2, 3, 4 week time when we hit the 70 and 80% vaccination rates, a lot of the restrictions will be eased. That means there'll be a lot of people moving through our region, and a risk again that I think every community across the region will see COVID in the next 2, 3, 4 months in the community. And so we can't change those things that we're doing at the moment to try and slow the spread. It's going to be crucial for us to maintain that in coming months to help us keep the numbers of COVID cases down.
Great, thanks, Scott. And just one more question. Just with the Oberon sewage detection mentioned yesterday, is there any other further concerns today?
Oh, so it's great to see so many people come out and get tested yesterday, and Oberon can encourage everyone to continue to come and get tested if you haven't been tested, or even if you have and you've had symptoms come on since you've been tested, please don't hesitate. Come and get tested at the drive-through in Oberon.
Great, thanks, Scott.
Thanks, Chris. Ollie from Wynn. Ollie may not be on the call, my apologies. Xanthi from ABC Central West.
Can I just get some clarification around it? Why is Narromine having to wait a few days before the lockdown orders? What kind of differentiates from Orange?
Hey Xanthi, sorry, mate, I can't quite hear you. You might need to get closer to the microphone.
I think she was asking why the Narromine had to wait for a couple of days until the lockdown was ended.
Yeah, can you hear me now?
Very faintly, Xanthi. But yeah, so I'll pick up that question around Narromine. Obviously, you know, the specialist team that's trying to take stock of all of the levels of risk has clearly looked at the last case dates, sewage detections, testing numbers, and a range of other factors of when people were infectious in the community. And those are the people that I trust to understand this much better with a specialist mind around public health than I do. We do know that there's the latest case was identified in Narromine on the 11th of the 9th. Now, that person is still in the home being cared for with COVID. That may not have been the last infectious case, but there's things that will be taken into account all the time from when there's risk for a community.
Okay, hopefully you can hear me a bit better. At the start of this, when cases were really high every day, it was suggested that the region would never return to COVID zero. Has that view changed, and if so, why?
Listen, Anthony, it's pleasing to see the numbers decreasing. I think that tells us that we can dampen the number of cases that have been and people that are picking up COVID on a daily basis. What we know, though, is that the stay-at-home orders were very effective in helping to do that, stopping people circulating around and slowing the number of people that can pick up the infection. So that's been effective. We really do need to turn our mind to what are the things that are going to help us slow the spread of COVID. When the restrictions are released further with 70 and 80% vaccination rates. So those are the things that will be crucial for us. I don't think we'll ever see a 0 day in coming weeks, months and years in Western New South Wales again. And so there's cases that will be identified in Cowra, in Walgett, Burke and other locations, I'm sure, in coming days and weeks. That'll mean we've got a real risk of spread in a lot of our communities. So I don't think anyone should be at ease and really relaxed around this. If you've been released from stay-at-home orders, then there's some liberties and freedoms that come with that, but it doesn't mean relaxing the things that will help us stop the spread of COVID or assuming that there isn't COVID in the community.
Thank you very much.
Thanks, Anthony. Andrew Fisher from ACM.
Yep, thanks. Scott, can you give us any more specifics about the Cowra cases? Things like their age, how many are adults, how many are children, and whether they're being cared for in the community.
Sure, Andrew. So all of the additional 5 cases that have been identified in the last 24 hours are children aged under 10. There's clearly been a spreader event at a school bus or other venues, and so there's some real concern there that there's possibility for further spread of COVID in Cowra. All those people are being cared for in their home by a specialist, care in the COVID community teams.
Actually, I've just got one more too, Scott. You mentioned the concern about the spread in the Aboriginal community. Are any of the Cowra patients members of the Cowra Aboriginal community?
I couldn't tell you that offhand, to be honest, Andrew. We do know that there's been a reasonable number of cases in the last 48 hours that have seen spread in the Aboriginal community right across Western New South Wales. There's some new cases in Burke, Walgett and other locations as well.
Okay, thanks, Scott.
Thanks, Andrew. Alex James from ABC Western Plains.
Thanks, Matt. Hi, Scott. I wanted to talk Dubbo, the fact that we're seeing 0 cases at the moment, but there was a mention that about 750 tests were taken over the last 24 hours. Considering Dubbo has a population of well over 35,000, are you concerned that the number's 0 because we have low testing rates?
Listen, I'd love to see testing rates much higher. We know that with the surveillance testing now in place, people don't need to isolate if they don't have symptoms unless they've been in contact or in a household with someone with symptoms. So please, can I encourage everyone in Dubbo and the surrounding communities to come and get tested on a regular basis. We know that there's been people infectious in the community in Dubbo in the last week and 10 days. There's no doubt that there's potential for further spread, and so please, everyone still be on guard. Stay at home, do all of the right things. We know that the stay-at-home orders are going to be crucial in all of this. With the testing numbers decreasing, there is some level of concern that there may be further people infectious in the community that we're not picking up at the moment. So please, if you've got symptoms, don't leave your home without coming and getting tested. And if you don't have symptoms, come and get tested, and you don't have to isolate unless you've been in contact with someone that does have symptoms.
You did mention before that there was a significant increase in the Indigenous community of cases. Is that also indicative of the increase of cases in Wellington?
Across a number of places, we know that there's been Aboriginal people across the whole of the region that have picked up COVID in the last 24 and 48 hours. So Can I ask everyone in the community, this isn't an Aboriginal, non-Aboriginal thing. This is all of us together. We've got to stop and slow the spread of COVID in Western New South Wales. Testing is going to be crucial, as well as vaccination.
Thank you.
Thanks, Alex. Taylor from Daily Liberal.
Hi, Scott. I'm just wondering if Dubbo from today completes its 14 days without any cases, will we potentially be looking at our stay-at-home orders lifted, or is Wellington's cases going to affect us?
I think we'll need to continue to refine how we look at the stay-at-home orders. The specialist public health team are going to need to look at both localities and full LGAs on a regular basis. So I don't think we have all of the answers to that. It'll need to continue to evolve.
Thanks, Taylor. That is everyone. Thank you very much, guys. We'll call it a day. I'll get the recordings out as soon as we can. Thanks for attending.
Thanks, everyone.